Um, so again, as I said, that the topic of the presentation is the 19 things to know, but actually there are 190 things to know. So, but we needed to come up with a topic, so we said 19 things to know. There is just so much unknown about this virus that we cannot pick a number, but we needed to have a catchy title, so we just said, okay, let's do the 19 things to know about COVID-19. I don't have any financial benefit. So what is COVID-19? A lot of this information is not scientific information. I'm trying to do my best to keep the information as layman's language as I can, but if I convert into my science mind, please remind me and I can switch my gear. I have also tried to put all those answers which I have been getting from my community, from my friends, my family members, brothers and sisters, but also from my colleagues as well. A lot of this information is also guided by the WHO, which is World Health Organization, and CDC and the MDH. And the reason that I did is because we want to give you as much information, as much current information as it can be, but also give you the evidence-based medicine and also what Minnesota State is following. So a lot of this information is already existing out there. I just compiled it and presenting it here. So we all know that what is COVID-19? It is a novel virus. And why it is a novel virus? Because it has never been found in people before. There are a lot of coronaviruses which have been found before, but this is the type which has not affected human beings before. That's why it is called novel. It presents like a flu-like illness, but it's not a flu virus. I got this question a lot, is it flu? But it is not flu. Structurally, these two viruses are very different. So there is no correlation between the flu and the COVID virus. Can you have both illnesses together? Yes, definitely. We have seen a lot of patients who had flu positive and COVID positive both. So similar looking illnesses, but different viruses. It can also present like a strep-like symptom, but it is not a strep. So it can be a little confusing. It can also present like a GI flu-like symptoms, but it's not a GI flu. There's a lot of things which are unknown about this virus, and we are still learning a lot of things about it. It's an unpredictable beast and puzzle that science is still learning and trying to solve. I'm trying to forward my presentation and it's not letting me do that. It's definitely a pandemic. As you can see in this map, that globally as of like July 24th, it is all over the map. It is all over the map, and this is a map which is updated at WHO website. If you go to the WHO, it is updated every single minute. There is only one area which is a green land where we don't see any patients or any positive cases, which I believe that is because of the travel and the earlier implementation of the travel restrictions, and that could be the cause, or maybe they just implemented their policies very quickly. But other than that, it is all over and it is spreading. And if you say India is completely blue, US is completely blue. So we are the two countries which are, and this is like Russia is completely blue. So it's, we are the two countries which are struggling a lot and have a lot of cases, and trying to do our best to control this. A little bit of Minnesota statistics. We have a total positive cases about 50,000. We are currently in the surge, as you can see this graph, that it is increasing. Yesterday we had 871 positive cases. We were down to around 200, but since July 8th, we have been constantly uptrending and have been ranging somewhere between 600 to 800. And yesterday was, I think, was the highest in last couple of days, 871. Our mortality or the death rate is a little bit lowered as compared to in the beginning. I think yesterday there were only 3 deaths. So we have been able to do a good job in keeping the mortality rate down, but our cases numbers are definitely getting higher. This is a graph of total confirmed cases by age. So if you see that the highest number of the cases are in the 20 and 29, but and the 80 to 89, there are only 1,741 cases. But if we look at the mortality, the highest number of the people who are dying are in the age of 80 to 89 and 60 to 69. So what is happening is that even though confirmed cases are very high in the young adults, but they are able to cope up. And that's how the community spread is happening. So if they are contacting our elderly community members, then they are spreading, and those who range from 60 to 90, they are not able to cope up, and unfortunately it leads to deaths. These are also some Minnesota statistics. As I just said, that a lot of it is happening in the community spread. So you can say community known cases and community known cases are the highest way that we can, that's this virus is spreading. So this is where the biggest action need to happen. And then that's the only way that we can control this virus, by community education and following the guidance or the guidelines that the system or the healthcare system is providing to the community to avoid the spread of the virus. How does it spread? It's a droplet spread right now. So in the beginning, when it was happening, it was thought to be airborne, but now it is shifted to the droplet. And when we say airborne diseases can be spread. The particle size is really, really small, and you can spread just by talking. And whereas the droplet, the particle size is a little bit bigger, and it's more when you are coughing or sneezing. So that's the difference between the droplet and the airborne. But so right now the COVID comes into the category of droplet spread. But 30 to 45% of the people who are infected, they do not develop the symptoms, but they can still spread the disease. So they might not know that they are sick, but if they end up coughing or if they end up sneezing, it's very well possible that they might spread the virus. I already explained a little bit what is the difference between the droplet precaution and the airborne transmission. And the reason it is important to know what is the difference between the droplet and the airborne is because that's how we are going to protect and prevent the spread of the virus. Because if someone is sick, what to do, if you're communicating with your friends, what to do, and I'll be talking a little bit more about that later. I have some fun fact in between because we have been, as a healthcare community, we have been getting these questions. Can shoes spread the COVID-19 virus? The likelihood of COVID-19 being spread as shoes and infecting the individual is pretty low. But as a healthcare provider, what I do personally is that I have 2 pairs of shoes. I take one to work, and I take one. I have one in my car, and that's what I wear when I come back home. So keeping the shoes outside the home or keeping them outside in your garage is way safer as compared to bringing the shoes inside the house. How does it present? The symptoms have been constantly evolving since the beginning. Initially, there were just a fever or chills or cough or shortness of breath, but fatigue, muscle or body aches, headaches. The most common symptoms we have been seeing lately is the new loss of taste or smell. Sore throat, congestion or runny nose was just added 2 weeks ago in the symptoms, and nausea, vomiting, or diarrhea. This is the spectrum of the symptoms, but there are a lot of weird things that we have seen. And when it came to the COVID, we have seen people presenting with leg pains. We have seen people with weird rashes coming to the ER. So anything which does not look right to you, or which it looks something is off, that needs to be evaluated, or people need to seek the provider to get a sense what is going on. Um, a lot of people might not have a fever, but extreme fatigue is the sign that we should be monitoring really closely, especially in our elderly community members. The reason is, and I'm just going to give this story. I had a colleague, and she's a physician. She was trying to check upon her mom and dad who live by themselves, and they said, oh, we are just doing fine, there's nothing to do. And then mom happened to mention, oh, your dad has nothing to do, he's just sleeping a lot. And that triggered her. She says, that doesn't sound right. So she arranged for the pulse oximeter. He didn't have any other symptoms other than sleeping a lot, and his pulse ox was in 70s. So he was ultimately admitted and was found to be COVID positive. Another story, a mishap that happened in my family 3 days ago. One of my uncle, he was just fine. He had lunch and then he went to bed and then woke up and he said he had a shortness of breath. Was brought to the hospital. His SATs were in 40%, and within 7 hours he died. So this is an illness that progresses really quick, depending upon your immune system. If your immune system is not a strong, capacity and capability to fight this is not that great. And people can go from being really well to just getting sick within a couple of hours and unfortunately dying. So keeping a close eye on the symptoms is very important. These are some severe symptoms that I already mentioned. The new confusion. So if you have elderly parents in your house and it seems like something is off and people are not making sense what they are saying, that is another symptoms that we need to watch. And again, as I say, inability to wake or staying awake. And the severe symptoms, of course, is bluish lips or face. So most of the people have mild or moderate symptoms. They can get better without going to the clinic or into the hospital. Some have no symptoms. Some people unfortunately die. There is some correlation and evidence that the people who get infected with COVID, there is a correlation between the blood clots, strokes, heart damages, and other damages. We have seen significant number of blood clots. I would say at least 5 to 10% of the people end up getting the blood clots. So if you see that your lower legs are hurting, especially the back of the lower leg, that is something that some people need to watch and seek the care, emergent care right away. And as I said, that this progresses really quickly. We have seen a significant damage of the lungs. It just destroys your lung. So some people have a severe lung damage and they end up being on the oxygen for several months, and the oxygen capacity, their lung capacity it just damages really bad. I cannot say out of our older adults and people who have a chronic medical conditions, they need to take extra precautions. CDC has this information that 8 out of 10 COVID-19 deaths are reported in the US have been in the adults 65 year and older. We need to protect our folks. And again, as I said earlier, the 1 in 5 people hospitalized from the COVID-19 were the young adults, but that's how the community spread is happening. So these young adults survive, but then the folks who are 65 and older, they end up dying. There is a strong, there is some correlation in the mortality in the chronic condition. There is a strong correlation between the cardiac condition, cancer, if someone has a chronic kidney disease, COPD, or if they have obesity or diabetes, then they are likely chances of the poor outcome. Then there is a moderate association if someone has an asthma, history of a stroke, hypertension if they're pregnant, or if they're on long-term steroid, then there is a moderate correlation of the poor outcomes. And there is a mild relation or the mild correlation between any other chronic lung condition, which is not asthma or COPD, diabetes type 1 or the liver diseases, that they can have poor outcomes. So coming back to the testing, there are different type of testings which are available. PCR is a testing which is a nasopharyngeal swab and the oropharyngeal swab. There's the antibody test available, which is a blood test. Saliva testing is in the testing phase. We still don't have a good sensitivity, specificity on that test. There is a finger test coming. And there is some other sample test like a fecal or the urine test might be coming too. So far, the 99% sensitive and 97% specificity is for the NP and the OP swabs. So that those are the most common that are being used. We have to make sure that if someone is negative or if someone is positive, negative doesn't mean that you never had it, because there are false negative, there are 30% false negative. If someone is positive, that does not mean that you can never have it again. So you can still have it. If the antibody test is positive, that doesn't mean that you're immune to it, because the antibody test also is, first of all, people might do the antibody test too quickly, and the body doesn't start making the antibodies, like at least starting 3 weeks after the illness. But there are studies or the data is suggesting the people start losing the antibody after 60 days. So having an antibody does not mean that you are immune. Saliva test is actually happening. We are testing it at the U, but it's not out in the market yet because of the sensitivity and specificity. We'll be doing a lot of testing on the other things. As in the bottom of the slide is said, it just actually was released by CDC on July 17th that a test-based strategy is no longer recommended to determine when an individual with SARS-CoV-2 infection is no longer infectious. And the reason I say that, because a lot of employers were asking us to give them the green signal to go back to work if a test is negative. There is just so much unknown about this virus that we cannot use test as a model for people to give them a clean sheet that you are good to go. These are some fun facts. Are there any specific medicine to prevent or treat the new coronavirus? The bottom line answer is no. There is no specific medicine recommended to prevent or treat, but there are a lot of studies going on. We have heard about hydrochloroquine, we have heard about the steroid, we have heard about, there are several things that we have heard, but there is basically nothing out there which is called a treatment. There are symptomatic treatment. If someone gets sick, they go to the hospital, and then we do the supportive measures. So if someone has let's say pneumonia because of the COVID, but then there are signs that COVID pneumonia is super infected with bacterial pneumonia, then you start the antibiotic. The steroid is a life-saving medicine, then we start the life. So it depends how your condition is, and that's how the medications are started. The other fun fact is that it is it's a virus, it's not a bacteria, so antibiotic do not work for that. I see a lot of that happening. It is happening a lot, unfortunately, in India, that a lot of people are getting antibiotic, and that is gonna make things so bad. The antibiotic resistance is gonna get increasing in India, and then the antibiotic will not be working for the reasons that they should be working. So if you see your friends and families, or if you're at home, if you have antibiotic that you got from your home country, please don't take it if you are sick. This is the protocol that, these are the things they actually do work. This is and we are trying to publish this information, so please don't share it with anyone yet. But there is a strong evidence that the vitamin C, quercetin, zinc, melatonin, vitamin D, turmeric, N-acetylcysteine, they do work, and there are different doses if you are taking it for the immune support, or if you're taking, if you have some mild symptoms. So vitamin C, definitely you should have a vitamin C and vitamin D at home. I personally take not 4,000, I personally take 2,000 every night, and I take vitamin C 500 twice a day. I also take a vitamin B complex. If you're taking a multivitamin, then the zinc, of course, is added. There is some evidence, I'm sorry, there is some evidence that potassium rich food like avocado, sweet potato, coconut water, all that helps. Ginger, turmeric, mushroom, leafy green vegetables. So basically eating the things which is gonna boost your immune system are gonna be really helpful. The stronger the immune system, the better you can fight this virus. As a Indian community or as a South Asian community, we do culturally believe in a lot of traditional medications. So there is no harm in taking those, but make sure that you do talk to your doctor if you're taking anything that you don't know. And the reason is because you might be taking something else, like for example, you might be taking a blood thinner, or you might be taking a diabetes medicine or something else. And sometimes a lot of alternative medication can interact with those medication and can reduce the effect of the medication. And that ultimately might put you at the risk of getting the infection. The least that you can do is taking the vitamin C and vitamin D. If that can be done, that will help in the long run. The news is all over, it's in all the media, that the only thing that is going to be helping us is, I was just looking at the data, until unless the 90% of the people in this globe follow this circle, this virus is not going to leave us. So social distancing, masking, hand hygiene, is staying home or sick, staying home when you're sick, and controlling the chronic condition. So 90% of the people, if they don't follow the social distancing, the virus is going to stay here. It doesn't matter like how hard we try. So that is that, if all of us start following this, then there is a hope that we might get rid of this sooner than later. I get a question from my patients and family: how about COVID-19 and my dog? How about COVID-19 and my fish or my cat? We know that it originally came from bat, but then there is no evidence that that animal play a significant role in spreading the virus. Though lately it has been found in some animals, it has been found in cats and dogs both. What we recommend is that if your pet tests positive for the virus, then you isolate the pest from everyone, including other pets. Please do not wipe or bathe your pet with chemical disinfectant, alcohol, or hydrogen peroxide. But it has been found, there are more studies going on, but there is no like a clear-cut evidence or data to go in a one way or the other. Are children protected? There's been a lot of news that, oh, our kids are safe, our kids are safe. They are not. They are not at high risk of getting sick. But what is happening is that the kids are carrying a lot of virus. Their viral load is really high. Their viral load is actually way higher as compared to the adult people. And what is happening is because naturally their immune system is stronger, so they are able to fight it. But because they have a higher viral load, they are shedding the virus more. So when they shed the virus more, then they are infecting the communities. But the children who are underlying conditions, they definitely are at risk. Children who have some behavioral health issues or developmental issues, that they are definitely at risk. 2 weeks ago, there was a death of a 9-month-old. And we have been seeing that some children have died from this. And if it does affect children in a bad way, then it causes the multi-system inflammatory response, and then it shuts down the system and unfortunately results into a death. Can it spread through the food and the meal? So currently there is no evidence to support the transmission of COVID-19 with food, but virus can survive for a short period of time on the surfaces. When we say the short period, shortest is 24 and the longest is the 3 days. So it can survive onto the surface up to the 3 days. So it is very important to wash your hands at least for 20 seconds. But we don't know. I mean, if we are eating out, you just don't know if people are wearing masks when they are cooking, if they are washing their hands properly for 20 seconds or not. So it's a risk. It is a risk. What if someone is does not have a mask and cough or sneezes on your food, and the virus is going to be living onto that food for 24 to 3 days? So then you are at risk of getting the infection. You can warm the food if you want to. Would it kill the food? Would it kill the virus? I don't know. I don't think there is enough sufficient data available. Travel and transportation. So limiting the, as we say, limit your travel and the transportation as much as possible. Make a list when you go to the grocery. So you're not going to the grocery store again and again. Go to the grocery store only once a week. Go before you go, wash your hands, and as soon as you come out, wash your hands with at least 60% of alcohol. And hand washing. Travel through the air travel. I'm not in, if you have to travel, then only travel. Different airlines are doing different things. I heard one airline is doing a really good job by maintaining the social distancing. So make sure that you ask a good question before you are reserving a seat. What are your policies and what is happening in the airline, rather than going into a crowded plane. Garlic. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food, but definitely there is no evidence from the current outbreak that eating garlic is going to be helpful. Do vaccine against pneumonia protect against the new coronavirus? No. It can protect you from getting the pneumonia, bacterial pneumonia, but not the COVID-19. So if you are due for the pneumonia vaccine, definitely take it, but not thinking that it will protect you from getting the COVID-19. I get this question. It's a very common theme on the WhatsApp, like make sure that you're sitting in the hot sun for 25 minutes every day. Taking a hot bath does not prevent the new coronavirus disease. Being said that, it is still recommended washing your hands, washing your feet, changing your clothes when you are coming in and going out of the house. That definitely is going to be helpful. Being able to hold your breath for 10 seconds. I heard about doing anulom vilom or doing the oming. Is that going to help? It's a good practice. I think we all should be doing, but it should not be, it's not that it is gonna, does not mean that you're free from the coronavirus disease. Some people have been doing these tests at home. Well, I have been able to do this. That means that I don't have it. But the bottom line is, if you have any symptoms, go and see the doctor. Exposing yourself to the sun or to the temperature higher than 25 degrees does not prevent, and it does not cure the COVID-19 as well. Spraying or introducing bleach or another disinfectant, it does not protect. The reason I brought this slide is, in the beginning, we saw a lot of people who were actually drinking bleach to kill the virus in their system. And of course, it doesn't help. It can cause GI erosions and can lead you to the hospital and can cause life-threatening problems. Adding pepper to your soup or other meals does not prevent or cure the COVID-19. So activity and exercise, I strongly encourage being active and exercising. Make sure that you're not exercising in groups. Try to go by yourself. Make sure that you're socially distancing at least 6 feet apart. And we recommend against wearing the mask when you are exercising, because you are breathing on your mask and it can cause growth of the microorganism. So it is a good idea to do the exercise without a mask in an open area, not in a crowded area. And you can protect yourself, because exercises and activity helps in maintaining your chronic condition. It boosts your immunity system and it protects you. So the bottom line is that the only way to protect yourself is um, the bottom line is only to protect yourself is by maintaining the social distancing and washing your hands and wearing your mask. I wanted to put this information um, because there has been a lot of especially my patient that I serve a very diverse patient population, and people have been negatively targeted because of this virus. People have been told that it is a Chinese virus on their faces. So please, this virus can make anyone sick regardless of their race or ethnicity. And someone who has completed the quarantine or has been released from isolation, it does not pose a risk of infection to the other people. That's a very misinformation. You can get sick again, and you can make sick someone else. Having antibody protects you? No, not at all. If tested negative, that means you don't have it. Not at all, because of the false negative rates. Um, and anyone coughing has a COVID. That's not. There's a lot of cough going on right now, which can be allergy, which can be sinusitis, which can be your acid reflux. Or there's so many things. So everything is COVID, but everything is not COVID. So giving some grace to everyone when you see someone coughing, because everything is not COVID. I'm done. I went very fast and open for the questions.
Everybody, good to see in this COVID season. Thank you, Roli. You did a wonderful presentation. It's yeah, we all have to wear the mask, social distancing, and avoid the crowds. That's the bottom line. But now, I have a couple of things noticed, or I came across some patients. Some people they had the infection, and they later on they became negative with the testing, but they are still having symptoms. I think those are called long haulers. They get shortness of breath, myalgias, and no energy, concentration is poor. Anywhere they are lasting from 2 to 3 months, some they are lasting up to 6 months. So that is unfortunately, we don't know what to do with them. So, and other thing is taking the medications for hypertension. Some people, they stopped. In the beginning, they thought AC inhibitors like medications, losartan, lisinopril, they stopped it. Actually, it is protective. When they have COVID, taking those medications are really helpful, and they will protect in the long run. And one more thing is kids, probably Atul Mishra will talk. Now also kids are getting affected. Just recently, a few days ago, some kids got significant rash on their body. It looks, we used to call that Kawasaki disease before. The presentation is like that. They're really sick with the rash, and their organs, multi-system organ failure is there, unfortunately. We thought kids are not getting infections, and they're really protected, but unfortunately it is happening. So we have to wait and see what's going to happen in the future. But taking the medications, especially diabetic medications, very important. Keeping the blood sugars really in satisfactory range can help the mortality. And blood pressure is taking the medications regularly will help, especially for this chronic, they have chronic comorbid conditions. So we need to emphasize the seniors taking those medications, very, very important. So we have to wait and see for so slowly all those symptoms and treatments, and every day we are getting the new information. So we just have to wait and see.